Welcome everybody to this Nurse Digest. My name's Margaret Dempsey and I work with APNA. APNA's collaborating with the Australian Digital Health Agency to bring you Nurse Digest, the monthly series of education sessions about My Health Record. Please type any questions into the Q&A section at the bottom of your screen. APNA and the Digital Health Agency would like to acknowledge the traditional owners of the lands across which we meet today and pay our respects to their elders, past, present and emerging. I'm speaking to you from Wathaurong country today. I'm going to introduce Nicola Graham from the Australian Digital Health Agency, who's going to talk to you about how to use My Health Record in practice and utilising case study applications. So thanks, Nikki, for joining us today.
Thanks so much for that, Marg. And hi, everyone. So we're going to go through a bit of information, and I'd like to talk to you about a little bit about privacy and security, and just go through some of those really key documents to highlight the ones that I'm going to go through in the live environment. But I would like, once we get into the case study, if you have something or a study that you're doing, or you've got a patient or patients that you try to find information for and you'd like more information, please interact with me there. So I'll again prompt you then. Okay, so the My Health Record system is managed in line with the Australian Government Protective Security Policy Framework, and it is stored in Australia and protected by high-grade security protocols, and that's to detect and mitigate against external threats. Now, the system is tested frequently to ensure those mechanisms are robust and working as they're supposed to. Now, these design features include many safeguards to protect the information stored within the system, and it includes audit trails, technology and data management controls, as well as appropriate security measures to minimise the likelihood of unauthorised access to the information in a patient's record. Now, in addition to these measures, My Health Record system is protected by legislation, which governs the way the system is accessed, managed and used. Okay, so there are two ways that a provider can interact with the My Health Record system. One way is through conformance software, so that's your clinical information systems, and the other way is through the National Provider Portal. Now, the agency has developed a sandpit environment, and we call it the on-demand training system. And that was made for providers to be able to learn how to use the system, and so they could learn how to practice uploading, viewing and sorting information, because you shouldn't be using a live environment to do that, or your own personal records to find out how the My Health Record works. Now, we can talk a bit later on about this, but if we have got ODT sessions that the agency is running with one of the educators, so if you need more information after the session today, you can certainly join in one of those. So I thought I'd go through some of those key documents, and this document here you can see is it's called the Medicines View. Now, it's an overview document, and as you can see along the top here, you can see the tab gives you access to the latest shared health summary. It also gives you the latest discharge summary if one is available. Now, the Medicine View in this particular view collates a range of documents. So any documents that's in the patient's My Health Record, it'll collate all the medicine information into one. So you might find information from a shared health summary or an event summary, PBS information, and even from the prescription and dispense records that will all be drawn into this view, and also any information that's entered by patients. Now, the Medicine View collates this because obviously that's a lot of information to search through. So you'll be able to see the source, the date it was authored, the medicine brand, and also some directions for use. So that's another good document to look through. And then the next one, if I can get this to turn. There we go. This is the Medicare Documents, and I'll go through this as well using sort of a case idea to see why you want to look at this medicine, other medication and the Medicare information. Now, historic Medicare information is triggered to be made available in the My Health Record when viewed for the first time by either a patient or a provider, and it can contain up to 2 years of pharmaceutical and Medicare benefits history. Now, we know around 75% of Australian medicines are subsidised by the government via the PBS. So PBS history in a patient's record is going to be an excellent starting point for you in understanding or trying to understand some medication history for your patients. And also the MBS claims history will be useful to help understand the patient's contact with other health services and also how frequent that may have been. All right. So the next one is pathology. Now, it's another summary document. So pathology report overview, this overview allows the pathology and even diagnostic imaging to be viewed in a streamlined way. So say if you're having to go through a whole range of pathology reports or diagnostic imaging reports, it again collates all that information into one streamlined view. So then you can sort within a specified date range or a test name. And the screenshot here, you can see grouped by test type, by specimen collected date as well. Now, any hyperlinks within that document will take you through to the original source document. Okay, so I'm just going to bear with me, everybody, while I stop sharing that one. Close that one. Now, I'm just going to share my screen again. And please let me know if you can't see the info. Okay, can you see that? Megan, is that good?
Yep, all good.
Perfect, thank you. Thanks, Mark. Okay, so we said we're going to go through some case studies. So let me see if you've got an asthmatic patient that's coming in to see you and the patient's not been to you before, or it is a current patient and the patient's been to another provider over the weekend and they've had some medication given to them. Whereabouts do you start trying to find out what they've been prescribed? It may well be that they've got some sort of a reaction to the medication. They might have had an acute episode. So there'll be a range of areas that you can find the information. So if you're looking for medication information, now remember before I gave you a bit of a clue, it's the medicines view will give you access to medications and it will source all that into one view. So to find that, we'll go, this is best practice software. We'll go to the My Health record, you can go here. And also in best practice, the drop down bar here, you can see you can go straight to prescription and dispense information. So that's another way to view medications. So let's go into the My Health record first. So this is opening up the document view within the My Health record. You have your patient with you and you can say to them that you're going to access the My Health record with the view to see if you can find out the medications that they've been prescribed and do some more work with it. Now, importantly, whenever you're going into your patient's My Health record, and regardless of the software that you're using, be aware of your filters. So here, this filters for best practice, it does give you a year. But if the patient says to you that it's something they took 2 years ago, you might need to expand this filter. Now, as I said before, this is a test environment. So I am going to expand the filters because I need to make sure that I can show you some data. Once you've ever changed a filter here, make sure that you choose update. So if you've been looking for information previously and you haven't found any, that might be one of the little things that have gone wrong. Now here in this document list, you can see that it's the medicines information's here. This also allows you to sort by document and it puts it alphabetically. So if it was alphabetically, you wanted to find something, just click on this icon here, or this document tab, and it will put it into alphabetical order. So we've done that. So I'm just going to scroll through to find the medicines view. Now, remember, we just talked about the medicines view collating all that medication information into one streamlined view. We'll just double click that to open. Now here you can see the medicines view here, and it just simply says click here for the medicines preview. So you could scroll through and see here the medicine information here. This is sorting by date. So if the patient had said to you they were at the doctor's or they got something just over the last few months, then you'd be able to sort by date. You can also sort by active ingredient here by clicking on active ingredient, and that will obviously then put it into a better view, as in it's alphabetically, so maybe that might be easier for you as well. Now, any links within this document, as I said before, they take you through to the original source document. So this is the shared health summary. So you'd be able to see medication information here. But if they're at the hospital, the other way you could see the information would be through the most recent discharge summary. And again, that may be available here. And just be aware that underneath here, it's got the date that it was available. So just click on discharge summary. So the discharge summary here, it's a lovely streamlined view, and it gives you all the information here around what medications they're taking. So that's a great first start, especially if the patient says, I was at the hospital and you haven't received a discharge summary. You may well find that on the patient's My Health record. So we'll just click this little red button to go back, so we don't have to go back out of that this particular view. Now in here also is the allergies and adverse reactions. So if the patient had said to you, they gave me some medication, but it really made me so incredibly sick, I have stopped taking that. So that's where you'd go into allergies and adverse reactions. And remember I said this sources all available allergies and adverse reactions that's available in the patient's record into this one view. And here you can see then the source document. So again, you can click on one of these source documents to take you through to the original information. Now, if you, so we'll close this one up again. So say you found out that it was prednisone they were taking and it has made them quite sick, they've had some sort of an allergic reaction to it, then you could upload an event summary, or you would upload your change your clinical information to add that into your clinical software, so that then anytime you do a shared health summary, that information would go up. So let's close that down. So that's trying to find medication information, and we've basically looked here in the medicines view, and I'm just going back here so I can get back into this view. Now, I did say before that you can find medication information in prescription and dispense information. So this is still looking in best practice. Here you'll note exclude prescription and dispense records. In order to make that show, you have to untick this box, okay? So untick this box and then choose update. And what it will do is it'll bring up the prescription and dispense information so that you can find that information in here. So once again, if we scroll down, well, let's just search. We can put the search on so that we don't have to worry about it. We know this is alphabetical. Let's go down until we find, so here you can see individual prescription records. So, I mean, obviously this is uploaded by an aged care residential service, so you could definitely open that up there. And then there's some more here. All right. So let's close this view here, and I'm just going to show you another way to find that prescription information, which is a much easier way to see if that's what you wanted to look at straight away. So at that top tab, go view prescription and dispense information. And now again, just note up here, it's only 12 months worth of data. So before we even look, we'll extend that date out and just say view. Now this will show you a lot more information. So, and obviously this is dummy data, so there might be a lot more information in yours. So here you can see prescribed medication, and you'll know it's prescribed because over here it doesn't have a dispense. Where it's got a date, you'll know that that will be a pharmacy record that's been uploaded. To find out more information, in best practice, you need to untick the collapsed medications, so here, and then say view, and it will open these right up for you to have a look at. So here is prescribed. If you highlight the medication, so say you'd like to find out who did actually prescribe that medication for your patient, then you can click on this and it takes you through to that prescription record. So this is who's prescribed it. And it does give you the details. So you've got prescription items here, and down the bottom, you've got prescriber details. So it's a good start here to find out who actually prescribed that medication. And there's also, where available, there should be some contact details and maybe even an email address. So it's a good first start to find out more about that patient's medication. Now, let's go back in. Don't know why it's doing this. Close that up. Now, here you can see it's been dispensed, and we can tell that by first dispense and a date. If you'd like to find out more information, again, click on the hyperlink here as it's highlighted, and it will give you further details and the dispenser information. So if you needed to talk to that pharmacy, then that would be a good first start. Okay, so we'll just close that one up and close out of that one. And I'm going to close back out of that patient's record there. Now, can anyone tell me if you've got a patient coming in for a health assessment, when you're doing your health assessments, obviously the GP or the nurse practitioner, you may have been in to see a patient and have said you need to have a health assessment done, and you are due. You can access that patient's My Health record before the patient comes back in next time, or while the patient's with you, so that you can make sure that you book that appointment at the most appropriate time. So we'll go into the My Health record here again, because we're going to find out if they're eligible. It'll save having that rejection, and it also helps you make sure the patient comes back in at an appropriate time, and it saves mucking everyone around. So again, see down here on the document list, we've got exclude Medicare documents, untick, and then say update. Now this will show us the Medicare information. Now here you can see Medicare Overview All. So that will give you all Medicare that's in a patient's record without a limited time. So if there's 5 years, you'll see 5 years worth of data. And you can also view 12 months. So that will be really key for you. For today, I'm going to open up all, and that's because I need to make sure I can show you some information. So here we can see, this is the Medicare overview, and you can see the prescription information here, and lots of detail, which actually is a great first way if you've got a patient who can't remember the medication that they're taking, or they need a new script and they're not sure. You can also see immunisation information and organ donor, and then here you can see the Medicare. So this is the great stuff. The date, the item number, the description, and who the service provider was. So that's really great. If you've got the patients coming in for the care plan, you can quickly search by the item number and view looking for a 721 or a 723, or even a 732 if you're wanting to see how far apart they've had those. And what about the patients that's had the 5 visits to the allied health services? And they've come back and they've said, I don't remember how many I've had. I don't know where I'm up to. They may have had 2 podiatry, 1 with a physiotherapist and 2 with a dietitian. Looking in the item number, you'll be able to see the allied health number. And it does give you a great way to say to the patient, well, actually, they're still due to go and have another podiatry visit, so they can go and do that. And also, if you've got the allied health service provider that may ring you up and say, I'm not sure how many times or who else they've seen and where they are at. I just need to be sure. You're providing care to that patient, so you would be able to view the My Health record to ensure that patient can receive the services. All right. Now, Marg, if anyone would like to, I'd love for them to type into into the question pane, and if there's a document that you would like to see, or you had a patient come in and you'd really like to know how you find that information. So please type into the chat pane if you've got a question about a document or a patient that you have coming in. How do you find that information, and whether you are able to see that information in certain ways. So while we're doing that, I'm just going to open up Medical Director. So this is Medical Director now, and we're going to open up this patient's My Health record. So we'll go up here to the top bar, and this opens up, you can do this by also going through the letter writer if you're Medical Director, if you use Medical Director. But this is just as easy. So what we're going to look at now is if there's any advanced care planning. Yes, Marg.
Hi there, Nikki. Somebody has asked a question about, could you please discuss immunisations?
Yes, how to find the immunisations information. So I'll do that in a few ways, yeah. So if you are an enrolled nurse and you're giving an immunisation, you may want to find out whether the patient has had any immunisations, or that if they've had one just recently. So if you've got patients that transfer between different communities, you might need to find that information out. So once again, in Medical Director, this is here, show Medicare records. So we'll look at the Medicare record again. Now this will display what we saw before, and I'll go, again, this is overview past 12 months and overview all. Double click to open. Now, I'll see if I can make that a bit bigger for you. Here you can see the Australian immunisation information. Now that's not just your medical practice, this is actually anyone who's provided a immunisation and they've sent that through to the registry. You'll see the information in here, so you can find that here. So if you're an EN, or even if you're any nurse or anyone who wants to just only upload the immunisation, then you can check first whether how long ago they've had it, if that's what you're concerned about. You can sort of see other information in here, so you know when they've had that immunisation. And the other thing you can do then is upload an event summary. Now, ENs are able to upload an event summary, but they are not able to upload a shared health summary. And you wouldn't upload a shared health summary to just include one immunisation, because the shared health summary contains 4 key areas. So that's medications, allergies, adverse reactions, and immunisations. So if you don't have all of those things up to date, then you would not upload a shared health summary, and an EN is not able to. You'll do an event summary. So I'll show you that now. So once again, a medical director will open up this information. I haven't been in here previously and added anything, so this might look a little bit slack, but we'll have a look anyway. Create clinical document, and then we'll go event summary and double click to open. Now, if you've only given an immunisation, you can say, you can put in a bit of a story as to what you've done for that patient, and the reason you might be doing just a travel immunisation, and where they're travelling to, and you can write a bit of information here. You can import progress notes, but I would imagine that unless you've written progress notes and you're happy that and content that you can include all that information, then you could put that there. Now, scrolling down, you can see newly identified allergies or adverse reactions. So if you had an immunisation that they had an allergy to, then you most certainly would add that here. And then down the bottom, I'll scroll that down. And then you could put in any immunisations you've given. So here it is here. Now I've just selected more, but if you've just given a new one, you could do that here. So you might say, I've just given a Pneumovax to this patient and I really want to share that information with my health record. This patient might be visiting you from another area. So you could then add that information. So just simply tick it and that will include that into this event summary. And I'll just show you what that's going to look like. Send to my health record. And this is a preview. So as you can see, if there was another nurse or in another medical practice, or they presented at the hospital, they'd be able to see what that was all about. So why did you just upload an immunisation? It's a travel immunisation. You might have more information. The immunisation that you gave, or immunisations that you've given, and then you share that with the My Health record. I hope that answers the question that you asked around immunisations. So do we have any others, Marg?
Yes, we do. So if if you're doing a scheduled immunisation, why would you upload an event if it's going to show on the register, My Health record anyway?
So you wouldn't necessarily need to do an event summary to just upload immunisation. So you share it with AIR like you would normally do. But if that immunisation is part of updating all of their information within the My Health, within the clinical software, so you may even upload a shared health summary if you've updated the medications, if you've added a new adverse reaction, or if there's some new medical history that you wanted to include, or even that you might have gone through and cleaned the data up, so you might want to add that information. So you wouldn't necessarily just do that for an immunisation. It's up to you.
And another question is, will My Health record have the person's last cervical screen date recorded?
No, I don't know that cervical screening is actually going up to the records. I'm just going to click back into best practice. It's just a bit quicker. We'll go all. So this is the Medicare data. So you can see immunisation information, but you'd have to find pathology is what I'm looking for. Sorry, bear with me, everyone. So let's go to Pathology Overview. So if the provider's connected and uploading pathology, then you may find that information in here. I'm just going to expand my search. So this is 2019. Remember I said this is dummy data. I'll just update that. Now, if you're looking for any type of pathology, histology, and you know the provider that you send that information to. So if you send through that cervical screening to a specific pathology provider, and you know that they share to My Health record, then you'll definitely be able to see that in the My Health record. And you do that through Pathology Overview. But if they're not registered, then no, that information will not be available in the patient's My Health record. Any other questions, Marg? So this is actually the pathology review, yeah?
That's right. I'm just getting to work my way through, but I do want to let people know that we actually take note of all these questions, and the staff at the Digital Health Agency answer them, and then I put them up into the My Health Record community of practice. So if you're a member and join that, you'll see the list of all the responses that you, all the questions that are asked today if we don't get to your question.
Okay.
Let me just...
So while you're looking at the questions, I'll just explain this pathology overview that I said before. It collates all that information into this one view. Now, as I said before, you can do different sorts. You can sort by organisation or test name. And once you've done that, if you click on this report, it will take you through to the original source document again. Now, obviously, this will look much better in your real live systems, but if you are looking for some pathology, it would be worthwhile having a look at that pathology report as well.
So if the patient doesn't have a My Health record commenced but is happy to start one, can you still view the record for medicines, pathology, diagnostic?
So if the patient doesn't currently have a My Health record, and you're going to go in and
is
do a
happy to create one.
Yeah, so he creates a record. So only information from that point in time goes up to the My Health record. The only thing that comes in retrospectively is the Medicare information. So you may have up to 2 years worth. So that will include those prescriptions, so PBS information, immunizations, organ donor and Medicare services up to 2 years. The patient can actually choose not to share that as well, so just be aware of that. But nothing from previous, only from that point in time going forward will be on the record. Any other questions, Mark?
That's good, but we are just nearing the time, so I think we need to just finish up. Is there any other comment that you've need to make to end your presentation?
Yes, so I'll just quickly share my screen again. Sorry, everybody. There we go. Hopefully you can see that. So we have got some free online modules I think I've mentioned to you before, really great for you to go in and have a look at. And we've also got, if you're looking to contact the agency or find out what we're up to, you can follow us on LinkedIn, Facebook or Twitter, and you can also call the 1-800, the 1300 helpline if you need any extra help. So that was all from me. Thank you very much. I certainly hope you got something out of that today.
Thank you very much, Nikki, for providing that information. I'd just also like to let you know that APNA has the new online learning about My Health Record, taking your patient care to the next level. So you can search our online learning store if you want to take up that information. Excuse me. Feel free to join the community of practice as well. You can just you can get onto our website and search communities of practice and the information is there, or contact APNA, ask for me, Margaret, and I can help you get on board if you like. And also, finally, I'd just like to ask, put out an expression of interest for any nurses who'd actually like to join into our panel at the next Nurse Digest next month. We do have the Digital Health Agency forming a panel and being available to ask questions, but it would also be great to have the involvement of a nurse who is using My Health Record in everyday practice. You don't have to consider yourself an expert. And in fact, sometimes we prefer not so, because it's someone who's just using My Health Record. Then we can work out and hear from you about any challenges or barriers, but also about handy tips. Nurses love to hear from other nurses. And so if you're a regular user of the My Health Record system, we'd love you to get on board and join our panel next month. We'll put information in the email that gets sent out to all of you. It'll be sent out tomorrow. And please contact me if you'd actually like to join in. We'd love to have you join us. So thanks very much, Nikki. We appreciate you joining us today. We hope you enjoyed today's session of Nurse Digest. So thank you and goodbye.
Bye.